As many of you will know, last week was Mental Health Awareness Week, and there are a huge number of blogs and events and resources that are available to talk about this really important issue. On Tuesday, the think tank IPPR launched a really important report called Education, Mental Health, which you can download from the Sunday Supplement, which identified 4 barriers to achieving really excellent mental health provision in our British schools. At the launch, the Chief Executive of School 21, a free school in Newham in East London, talks about 3 things that they do to protect young people's well-being and mental health. Firstly, they talked about small schools. With a gradually expanding school, the need to keep that intimacy and that closeness that a small school provides, of no more than 75 students. Secondly, at School 21, they have 2.5 hours a week of counselling, where one member of staff works with 14 students in a close and intense way. Challenged by the audience, who said that actually as a free school that was a privilege and a luxury that many schools would love to have, Ed pointed out that actually that ratio of staff to students is the average of schools in the UK, but it requires all staff working at the same time and no staff on PPA time during that 2.5 hours every week. So it's something that all schools can achieve. Thirdly, the curriculum. Ed, the Chief Executive, felt very strongly that School 21's commitment to project-based learning really supported their students and increased their well-being and mental health. In the ensuing discussion that we talked about the difference between mental health and well-being. One of the IPP report's findings was that even though mental health and well-being is included in the Ofsted framework since last year, only 1/3 of sample reports actually mentioned it. Perhaps one reason for this is some ambiguity about what those 2 different terms mean, well-being and mental health. Well-being, we think, is that stuff that Ed was talking about, the ethos of your school, how you design the curriculum, the well-being of every single student in your school and how you protect that. And then you have the other side, which is what happens when that goes wrong? How do you get early intervention? How do you work with agencies to protect the most vulnerable students in your school, which will always happen regardless of how good your school is? The report threw up a lot of issues, and I hope that you read it. Mental Health Awareness Week was an important time to explore some of these issues, but these issues continue throughout the year, and we really hope at SSAT that you will tell us what the challenges that you face are, and also what solutions you're finding.